Welcome to the Tic-Tective Podcast, a program of the Bay Area Lyme Foundation, where our mission is to make Lyme disease easy to diagnose and simple to cure. I'm your host, Dana Parrish, and I'm the co-author of the book Chronic, and I sit on the advisory board of Bay Area Lyme Foundation. This program offers insightful interviews with scientists, clinicians, patients, and other interesting people. We're a nonprofit based in Silicon Valley, and thanks to a generous grant that covers 100% of our overhead, all of your donations go directly to our research and prevention programs. For more information about Lyme disease, please visit us at bayarealyme.org. Dr. Neil Nathan is a medical doctor and a best-selling author of the book Toxic, which was life-changing and game-changing for so many patients who are so sick with chronic illness and did not understand the toxic piece of it, from toxic mold to the things that we're eating to the infections that we're carrying. He has been an absolute light in the darkness of chronic illness, that is for sure. He also just published another fabulous book called The Sensitive Patient's Healing Guide. I highly recommend both of those if you haven't read them yet. I'm so excited for you to listen to all of his wisdom and all of his knowledge today. Thanks for joining us. Hi, Neil. It is so good to finally meet you. Thank you for being on.
Great. Thanks for having me.
What I love about you is that you are an MD, but you are trained and you have so much knowledge and expertise in all the different immune hits that chronic illness patients are facing that maybe we weren't so sick with 20, 30, 40 years ago. And I'm curious just to start with, what is the average person looking like to you now, the average patient versus 30 or 40 years ago?
From the very beginning, I've had a practice composed of folks that were a little more complicated. My practice has become increasingly skewed over the years to working with those patients who are even more complicated. So, because I'm a strange puppy, I welcome complexity, which is kind of, oh, that's interesting. Like, bring it. Let's go study this. So I can't answer that question. What I can tell you is there's been an explosion of chronic fatigue syndrome, fibromyalgia, Lyme disease, mold toxicity, autism, cancer. These diseases have exploded. They came out of nowhere and they have taken over the medical landscape for those doctors willing to acknowledge they exist. Forgive me, I have colleagues who still don't know that those things are actually quite common.
Yeah.
So we're seeing an explosion of illness. I don't think it's a mystery about why we're seeing it. We also live in the most toxic planet that human beings could possibly have created intentionally. As an example, there are now known to be 350,000 new chemicals in our environment that weren't there 70 years ago. The number that have been looked at from a health perspective, 500. So we have, thank you, chemical industry.
Yeah.
We have willingly laid ourselves out as an experiment in how toxic can you make a planet before you implode. And if that wasn't enough, we've added EMF toxicity in spades. So we went from 70 years ago, you had a very little electromagnetic exposure. Now we boast. We have 5G, we have 10G.
Yeah.
And some people don't realize that, okay, we went from 4G to 5G. That's 4 to 5. That's from one. That's a one shift. That was a 1,000-fold shift in exposure to EMFs. And we're seeing an explosion of EMF sensitivity as well.
Yeah.
And then it becomes even harder for those physicians who do know about some of these things to sort this out. Well, how much of it is the chemical exposure, the mold exposure, the weakening of our immune systems so that we are much more prone to all those things in the tick-borne illness range. All of those things have happened on our watch. And, the government goes, I think we need another 20-year study to figure out why this is happening.
Right.
And I go, That's nuts talking. We are
Yeah.
already polluting this planet to the point that it may become uninhabitable. Those who are sick are the canaries in the coal mine. We are all going to be ill because our livers can't keep up with the exposure that we have. So I don't want to start this out on a negative thing, but I do think that all of us have to become proactive politically and go, no more. No more. Can't just add things. All of these chemicals, I don't care what it costs. It's going to cost us our lives, our children, our grandchildren, our planet. This is no longer a luxury of, well, that's probably a harmless chemical. We'll go along with that. It's sorry, guys, we can't afford that anymore.
When I was living in California for a few years, the whole entire HOA was sprayed by this chemical called Diquat. And our dog, by the way, I protested in advance. I saw the little signs posted. I looked up all the ingredients and whatever the brand name was. And I saw that it was sister to paraquat. And I did a deep dive on both of them, was horrified. They would not change course. And the reason why was because they had used to use Roundup. By the way, I don't know why they have to do any of this. They've got thousands of landscapers who like pull weeds. I'd seriously do it myself instead of spraying chemicals. They said they stopped spraying Roundup because 2 or 3 dogs died from it the year before. So they switched to Diquat. And our dog walked on our front lawn, came in, licked her paw, had a seizure, and basically it went deaf. Perfectly, she was super healthy. She started having seizures constantly. She had myoclonic jerking, and she was like a Parkinson's patient. She had this tremor, and she couldn't make eye contact. She was so scared from being deaf all of a sudden that she was shaking all the time. I called all these toxicologists, all these veterinary toxicologists who are like the ones who publish on all the toxins, and they look at, what these chemicals are doing to animals to inform what they will do to us. And they said, you have to move because what is happening to her is going to happen to you if you stay. And she's probably not going to get better in that environment. We tried different things to remediate like the interior of the house because they're so aerosolized, there's nothing we could do. We moved, literally, we just moved in, moved right out. It was horrific. I found out that my neighbor's dog, 3 doors down, she had a young golden retriever, died, had a seizure, and a little girl in the neighborhood had a brain bleed.
These are absolutely tragic. They're absolutely avoidable. And forgive me, it comes from human laziness
Oh, yeah.
in going, I don't want to pull weeds, so let me spray something on there that will kill weeds. And not realizing it gets into the groundwater. It gets, my dogs, I've got several, love eating grass. But then I can eat my grass, but my neighbors spray a variety of things on their lawn, and I've got to rein them in, and they can't do that.
Yeah.
But I think we can use that as a model for this is what's happening in the whole world. And we can no longer be passively going, well, whatever, spray, whatever, I suppose. We have to do our homework. And when our homework says this is toxic, um, we can't allow it. It's not a choice anymore. And I don't think most people get that okay, if you want to stay passive and simply die, so be it. Now, I'm
Right.
old. I've had a wonderful life, but I have children and grandchildren. I would really like them to be able to inhabit this planet. And that means we have to educate them to make a stance because, forgive me, our generation is not. We have allowed all of this. We have to take ownership of the fact we have allowed the chemical pharmaceutical industry to run rampant and make whatever profits it can without safeguarding our own health. And got to take it back.
You are very widely beloved in my community, in the Lyme community, chronic illness community. I want to dive into that a little bit, what we are missing when we are not getting better.
As my career progressed, my interest in outliers and helping other people and learning whole lots of other things led me to become medical director of a pain clinic back in the 80s. It was a hospital-based pain clinic. And we began to see at that point a condition that was called fibrositis, which we now know as fibromyalgia. It didn't make sense to us. There were these people who fatigued, ached all over, had irritable bowel syndrome, had a wide variety of other things. Like, what would cause all of that? Well, what medicine does with all of that originally is, okay, it's in your head. That's the first thing that we think. And so we treated them with antidepressants and benzodiazepines and therapy. It did basically nothing. So for those of us who were paying attention, it was clear this is a new critter. I don't know what it is. It is not a psychological illness. And we began over the years to figure out that there were a whole host of different biochemical perturbations that would trigger it. It could be triggered by magnesium deficiency, dysbiosis, food allergy, any number of hormonal imbalances, dental issues, a wide variety of things would cause it. And once we understood something was triggering it, we could actually treat it.
Yeah.
So at the time that most of these people were still being told this is in your head, there was at least a group of us going, no, 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 we know how to fix this. We know how to diagnose this, we know what to look for. Over time, at least in my world, the things that I knew to fix fibromyalgia worked in less and less folks. And then I began to realize I'm missing something. And here came Lyme disease. And after a while, with Lyme disease, I realized we're still missing something here. And then came mold toxicity. For almost any of the conditions that we could call chronic that we're looking at in our world today, neurological degeneration, things like Alzheimer's or Parkinson's disease or ALS and things like that. Those are caused by inflammation, and our job is to figure out what specifically is inflaming them. And the two biggies keep turning up to be Lyme and mold. It just keeps coming up. Some of your listeners may be aware of Dale Bredesen's wonderful work with Alzheimer's disease, in which Dale, as a research neurologist, came to this conclusion a dozen years ago, that they were missing the point of Alzheimer's. It wasn't these tau tangled things in the brain. It was inflammation triggering it. And if you figured out the cause of that, so one of the things that Dale figured out was that Lyme and mold were the biggies there. Yeah. And I want to emphasize mold because when I started working with Dale, he estimated that maybe 60% of his Alzheimer's patients had mold toxicity. That's kind of a wow. He would now put that, and does, at 90%.
Amazing.
So that if someone has Alzheimer's and is not looking at Lyme and mold as a possible cause and not treating it, you're condemning those people to having a miserable end of life. But if you get on it early, it can be, as he's demonstrated in multiple published papers, you get on it early, you identify the mold, you identify the Lyme, there's a number of other things that he's working with, you can get much better, if not cured. Yeah. That's a word that hasn't been used in the medical condition for Alzheimer's in a long time. So my key message is mold and Lyme are a major component of a lot of illnesses that are being labeled otherwise. Chronic fatigue, fibromyalgia, autism, all of them, if you look for mold and look for Lyme and you treat them, all of these conditions can be markedly improved, if not cured. We're missing a major thread to help so many millions of people. We're not talking about a handful of folks right now. We're talking millions and millions and millions of Americans have these conditions and don't realize that we have actually figured out how to know what is causing it and actually how to treat it.
How many buildings are water damaged?
I've heard estimates from the building industry that it's somewhere between 25 and 30% of all buildings have a significant amount of mold in them. So again, we're not talking minor, occasional, oh yeah, I'm sorry you had a bad experience. We're talking a lot.
It's been really hard to find a place to live because once you know about mold, It takes out all the green buildings, or many of the new people don't even know new construction is also a problem. Everybody wants to live in a new building. I live in New York City, and we see these beautiful high rises going up, and then I see all the airtight windows, and I say to my husband, nope, we're not doing that. Testing is so difficult. Convincing your doctor to give you a proper test for Lyme or mold, which we know there aren't terrific tests for Lyme anyway, but where would you start? And really, this would be great information for any clinician who is open-minded and listening to
Well,
this.
to me, that's easy. Actually, mold is easier than Lyme and more
Yep.
accurate. There are a number of labs out there who are doing testing. Most of the testing is simply collecting urine and seeing if mold toxin is in the urine. Forgive me, a lot of people say, oh, that's not accurate. That doesn't mean anything. This is a no-brainer. If there's mold toxin in your urine, it is coming from your body.
What brand of test?
I have tested all of the various labs with thousands of specimens. I am mentoring a group of over 200 physicians, and so we pool our information about which labs look like the most accurate, which ones are the most consistent. So our experience has been real time is the best, most accurate test we have at this point. It's covered by Medicare. Even Medicare recognizes this as a valid test for mold toxicity. So,
wow. Okay, that's great to know.
So, hands down, real time is the best test as far as we know out there. There are other tests. They have not stood the test of time. They're not as accurate. Mosaic has a test. Vibrant Health has a test. There's a new antibody test from my Myco lab.
Right.
Having had samples of patients' urine and blood measured in all of those and looked at it, it looks like real time does, from my perspective and my colleagues, the best job. Regardless, if any lab shows you have it, okay, great, we have a diagnosis. But I like to go with the most accurate that we have access to.
Right.
And by the way, I have no financial connection to any laboratory or product that I'm ever going to mention. I don't have any of those going. So my hope has always been that whatever I tell people is as clean as I can make it.
Appreciate that. Tick-borne diseases, Lyme and Bartonella, Babesia. Where do you like to begin the evaluation for those?
Again, we've got lots of tests out there. In my experience, and again, I'm friends with a whole lot of people in the Lyme community, I think that IGeneX is the most up-to-date, current, best test on the market.
For all of the diseases? Would you say for all of the?
I would say yes. I would say for all.
Okay.
It's trying to stay on the cutting edge of continually increasing the number of species of whatever it is we're looking for. So, for example, it's very common for people to say, well, I did a Western blot at LabCorp or Quest, and forgive me, I roll my eyes, because that only measures some of the antibodies that only Borrelia burgdorferi produces, one species. So you're really pushing your luck to think that if that came back negative, you don't have it. Since we recognized burgdorferi as the first of the things, some people forget that we've actually learned a little bit in the last 25 years. Yeah. So there are now dozens of documented, well-known, named species of Borrelia, tick-borne relapsing fever, which is a whole different category of Borrelia, that we need to be able to look for that in as many different places as possible to get an even accurate idea. So to me, IGeneX, without any doubt in my mind, does the best job. I know that Vibrant Health looks for some of those things. For whatever reason, I have not found it to be anywhere even vaguely as accurate. And that's been the experience of most of my colleagues who work in the field. There are other labs out there, and they're even less accurate. If you're going to get tested by the best laboratory we have. I don't know if you're lucky or unlucky if it shows up positive, but at least we know what we're dealing with, and then we have excellent ways of knowing how to treat it.
So for clinicians that are trying to clinically tell these two illnesses apart, vector-borne diseases, Lyme and mold, I know there's a lot of overlap. Is there anything clinically that are clues that it's more this, it's more that?
I mean, there are clues, but they're light clues. It's a little hard to tease it apart. I mean, once you've worked with mold and Lyme for a while, there's a feel for what you're dealing with. For example, I consulted with a young woman today who's in Florida, and she's been hospitalized for the last month with increasing paralysis from the waist down, along with every other symptom that both Lyme and mold have together. So,
Wow.
for example, brain fog, fatigue, anxiety, irritable bowel symptoms, constipation, diarrhea, shortness of breath, air hunger, all of those things. But mold doesn't typically cause paralysis. It typically does not cause that kind of neurological issue. So when I consulted with her, the family was hot to proceed with mold because she had just had a test which clearly showed she had mold toxicity. And they were really surprised when I said, yes, she does. And usually if you have mold and Lyme, I tell people to treat the mold first. You've got paralysis. You have neuro-Lyme. That needs to be treated first. You really need to be on IV antibiotics yesterday. And she's got experts of every type and sort. They've done every test on her conceivable in the hospital setting, and they're all shaking their head and going, I don't know what's wrong with you. And I'm looking at this constellation and going, I know what's wrong with you.
Yeah.
You have Lyme and mold. There's such a gap in education and for physicians that if you don't have experience with mold and you don't have experience with Lyme, then these are mysteries.
It's not even the lack of experience. They literally think they're fake diseases. I post toxic mold, including Dale's inhalation Alzheimer's study, and I post papers all the time. People freak out. They didn't know it was real. And I'm talking about scientists, doctors.
There is a huge educational gap for those of us who've been working in this field for 25, 30 years.
Mm-hmm.
And what is obvious to us, I mean, I'm looking at this and going, duh, I know what this is.
Right.
And you've got 50 doctors going, these tests are coming back normal. I have no idea what this is, which is open up your heart and mind to the fact that maybe you need to learn something in order to help people who are sick. We're not talking a few people here. I mean, the CDC, as you well know, has recently acknowledged that there are 675,000 new cases of Lyme disease every year. It is estimated that there are 10 million Americans suffering with mold toxicity. We're not talking rare, like you'll never see one in your lifetime. It's like you probably already know 24 people who have this already. Problem is they may not know it.
Right. Do mold and Lyme make one susceptible to the other? What's the chicken or the egg situation there?
There's no chicken and there's no egg. Both weaken the immune system and predispose for the other. So if you have mold toxicity, you're weakening the immune system and predisposing to Lyme. And the same thing is true vice versa. So what I see is I can't tell which came first. My job is to figure out what treatment my patient can handle first in terms of moving them forward.
Do I have to move? I'm living in a moldy environment. I cannot afford to pack up my house and put a new down payment, whatever. What am I going to do?
The hard, difficult, painful answer is yes, you have to move. There's a number of philosophies in the mold world. I teach one of them. Others are out there. The one thing we all agree on is you cannot get better if you are being exposed to mold. Sorry, world. Non-negotiable. Either get it remediated or move. Sometimes it's only a matter of removing some carpet from the house. Sometimes it's $200,000 worth of repairs and everything in between. So you shouldn't jump to the conclusion that it's not remediatable, but you should at least get a clear idea of, can this be remediated for a reasonable price, or do I need to move? But there is a bottom line here, which is you can't get better if you're still living in a moldy environment. I'm sorry. non-negotiable.
What about the people that grew up in the moldy house, but now they're 37 years old? They haven't lived in their parents' house for 20 years. What's the deal? Have they naturally, have they naturally detoxed? Could they still be colonized?
The answer is they're all different.
Mhm.
We are all biochemically and genetically different. With mold and with Lyme, you can be bitten by a tick, and if your immune system is robust, you may not manifest any symptoms of Lyme for decades. You could grow up living in a moldy basement throughout your childhood, and if your immune system is robust, you may not experience anything from it. Here comes the but. But if at any point along the line your immune system is exposed to a major hit, now that could be childbirth, that could be a surgical procedure, that could be an emotional loss of a loved one, a parent, a friend, a sibling. It could be an infection, COVID being a very good example of that type of infection. If your immune system takes a hit, and your immune system loses containment, then be it mold or be it Lyme, now we have a new ball game. It is now alive and well and thriving in your body, and your immune system is no longer capable of keeping it in containment, and we're off to the races.
Where do we begin when we find out we have been exposed to a high level of toxic mold? We've done real time.
What we've learned is that for the mycotoxins we can measure, which is the main ones, we now know which specific binders will pull that out of the body. If you all want to know what they are, in my book, Toxic, we lay it out for what we know. In fact, I'm just finishing a second edition of that book in which we're going to lay out an even more elaborate table of what we now know about, okay, we know which binders will bind which toxins. You don't go at it pity pat, which is, okay, I've got some ochratoxin, I'll try a little charcoal. You look at the whole picture of mycotoxins and go, okay, I've got these different mycotoxins, so I need to take charcoal, clay, chlorella, Saccharomyces boulardii, and I may need a prescription for Welchol or for cholestyramine in order to bind these properly. Depending on whether or not you've colonized, meaning the mold was in you long enough that it is now growing in your sinus or gut areas, you may need to treat with antifungal nasal sprays or oral treatment to really get the mold and the candida out of your body.
How do we know whether we're colonized?
It's very hard to know that. There's no really good testing for it. The first component, the fungal component of an oat test from Mosaic, gives some clues, but in no way is that test adequate to tell us you've colonized or you haven't colonized. The main reason we can figure it out is if we're giving you all of the right binders and we're measuring your mycotoxins, if they're not going down, doing everything we're supposed to be doing, and we believe you are in a safe environment, it's in you and we need to do more. So it's really a diagnosis of exclusion, a diagnosis of, okay, what we're doing is not working. We got to go add another piece to this.
I think it's important also to talk about the length of time it can take to heal from toxic mold.
Well, for those people in the Lyme community, these numbers won't sound so bad. But it takes at least a year, often two, to get mold and mold toxin out of the body appreciably. But keep in mind, we can measure it with our real-time testing. When we get it showing not present for all of the mycotoxins in every category, we're done. Treatment is finished. You don't have to do any of these things anymore. People always want to know, well, am I always at risk? To a certain extent. But most people, as their immune system recovers, their ability to handle small, occasional exposures to mold recovers as well. So the vast majority of people I've treated over the years gotten well. They're not always looking over their shoulder or, I don't know if I can be here. You can get well, yes.
That's good to hear from you.
I hope I leave that as my message. Everything I'm talking about today is treatable. So it's not a matter of going, okay, great. You can define one more medical condition that I have. No, I can define one more treatable medical condition that you have. And that's the key thing.
You mentioned COVID very briefly, but I want to just get your take on what you feel is going on with long COVID.
It's complicated. There is long COVID, but many things that people call long COVID are Lyme and mold toxicity that have been unmasked by this inflammatory process that I've talked about. So you're doing okay. Things are in containment. Then I get COVID. COVID wastes my immune system, and all of a sudden, things that were there, and I call that unmasking it. They were there all the time, but now they've reached the proportion of now I got to deal with it.
Yeah.
I'm no longer in the containment. So in my experience of that, of a lot of my colleagues, most people who think they have long COVID really have mold toxicity or Lyme. Now, you can still have long COVID. A test that I increasingly like a lot is Bruce Patterson's 14-panel cytokine from Radiance Labs, where he can measure 14 different cytokines and the pattern is clear. He can distinguish at this point Lyme from long COVID by his panel. And he and I have just been talking about beginning the process of figuring out the mold piece of that as well. So we can use that one test as a way of distinguishing, okay, which of these cytokine panels helps us to make the diagnosis of where we are or where we need to be.
I think we should also clarify that mycotoxins are airborne. I think the biggest route is probably inhalation. I know there's mycotoxins in food.
There is, but from my perspective, it's minor. The most experts in the field believe that it's airborne mycotoxins from moldy buildings is the primary thing of making people sick. There are some people say, oh, you get it from food or you get it from here, to such a trivial extent that I think that that's confusing people. It is moldy buildings that is the problem.
Indoor air.
Correct.
I use lots of HEPA. I have my windows open a lot. I mean, do you subscribe to these things?
I do. Ventilation through a home is key. That locking it up tight. I think part of what triggered a lot of our mold issues here is back in 1979 when we had the energy crisis, we went, oh my goodness, we've got to insulate our houses to the nth degree. We've got to tighten them up. No flow of air inside the body. And then when there was water damage, the mold could grow happily, unopposed by any natural environment and made people sick. So we kind of did it to ourselves. Now people who are more aware are building airflow into I have a new home in Southern Oregon, and it's built into my building, and the windows and doors are open as often as possible.
Yeah.
And I have a HEPA filter. So yes.
What did the collective trauma of COVID do to our nervous systems?
It trashed it. Just to point to the listener where you're going with this, I think I know where you're going with this, is that when patients have mold and have Lyme, they are seriously at risk for the inflammation triggered by both of them to affect the limbic system, the vagal system, or to trigger mast cell activation.
Yeah.
All of these things trigger sensitivities. COVID was handled so badly. It's a travesty of if you can do something badly, we did it. Having us isolate in buildings, stay 6 feet apart, not being near our loved ones, not being able to visit. When it first happened, I lived on the Mendocino coast. They closed the parks. Like, I'm sorry, what? It was almost like if we all isolate enough, it'll go away or go hiding. Forgive me, but that strategy has never worked in any flu ever known to humankind.
Mm-hmm.
And all it did was it took our limbic systems and our vagal systems and it put it through the roof, which is, okay, who can I trust? Human beings have been taught to recognize who I can trust and who I can't trust. All mammals do this based on facial features. Okay, cover us up. Cover up our cover up what we need to trust people with. So what we did as a global experiment was we absolutely fried the limbic system of every man, woman, and child on the planet.
Mhm.
Horrible travesty. So what many people don't realize, I'd say most people don't realize, is we need to reboot those systems, and we can. But we need to realize that we have been damaged by how we have all been treated and not been able to connect to ourselves over this period of time. Now, there are wonderful programs out there to reboot the limbic system. There's many of them out there. Um, Annie Hopper's DNRS, Ashok Gupta's amygdala retraining program, Primal Trust by Kathleen King. We don't have to be victims still. We can literally reboot our limbic system. We can literally reboot our vagal system. And for those of us who might have had our mast cells triggered again, if we treat what's caused it, once again, mold and Lyme, it's not a standalone diagnosis. There's in the last 10 years, there's a mast cell clinic in every major university center in this country. And they
Yeah.
treat it like it's a separate illness, which is, okay, we're going to treat this. There's no grasp of the fact that it's not a primary illness. It's caused by an inflammatory process like mold and Lyme. And in my experience, I've had hundreds of patients with mast cell activation who are cured because we got rid of what caused it.
It's so important that you say this, because I cannot tell you how many people I hear from who say, I can't treat because of my mast cells, or my mast
And-
cell disorder is a separate entity from everything else.
Right. And I want to take that separate place, which is mast cell activation, limbic dysfunction, and vagal dysfunction are all completely, totally interconnected.
Mhm.
So if all you're treating is mast cell activation, and some of my most sensitive patients can't do that, by the way, they can't take those substances. They're not starting at basics. They often need to do some limbic and vagal rebooting first for months. Then they will be able to take the mast cell treatment. And still, that's not the end point. Then we need to get into, well, what triggered that in the first place and treat that successfully.
Right.
So there's, as you know, I recently written a book called The Sensitive Patient's Healing Guide.
Yes.
I have contributions from 20 expert, fabulous authors in doing so, where we lay it out, which is if you've become sensitive to things like light or sound or chemicals or food or EMFs, we can treat that. It's no longer in your head and everybody going, well, you just need to be tougher, tough it up, deal with life. No, your nervous system needs to be rebooted. So we've learned a tremendous amount about this in the last 20 years. We actually know how to treat it and how to work with it. And it's super important that people realize they don't have to be victims. That we don't know everything, of course. We have lots to learn, but we
Yeah.
know enough now that we can help the vast majority of these folks get well.
I think we should also touch on the intuition of the patient. You know when things don't feel right.
All of this is about honoring your experience. So many of my patients, and you know this as well, have gone to 24 doctors before they ever got to me and been told, no way you could have all of those symptoms. That's crazy talk. You need to see a therapist or take an antidepressant. And they've been invalidated. And they're going, no, I'm sick. This is not in my head. I'm not an intrinsically depressed or anxious human being.
Yes.
I have something in my body. And so many of them have been told by medical experts or specialists that, nah, since I don't know what it is, it's got to be in your head. Trust what you know about you. If the person who you're working with does not know what you've got, think about it like your car. If your car was not functioning well, you keep bringing it to the same garage week after week, and they
Yeah.
say, you wouldn't do that. At a certain point, you'd go, I need a functioning car. I need to bring it somewhere else to get it fixed. Keep looking until you find the people who really can help you. That's just important.
And unfortunately, that is not going to often be in the mainstream when we're talking about complex chronic illness like this.
Unfortunately not. You're going to need to look in the integrative functional community for the answers because uh, conventional medicine has still not even begun to embrace Lyme and mold as a major part of understanding what's keeping people sick. And, and I do want to emphasize one thing. For any of you out there who have Lyme disease and have not checked mold, absolutely, please do. That one of the biggest stuck places in treating Lyme is that too many Lyme trained physicians have still not embraced the concept of mold. And I'm sorry about that, but it is true. And the symptoms that you have, which are so similar between mold and Lyme and Bartonella, you could be cured of your Bartonella and Lyme. And what someone is telling you, no, 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 that air hunger, no, we still have some babesia to work on, or no, you're still having some GI distress and feeling these vibrations in your body, that's Bartonella. No, 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 we're still not done yet. Please get checked for mold. It's so important. If you're missing that, mold is easier to treat than Lyme, and often your Lyme treatment will proceed incredibly better if you remove the inflammation that mold caused. I work very, very closely with a dear friend, Rich Horowitz, who I'm sure all of you know very
Sure.
well. I
Yeah.
love Rich. And I teach with him. We have a course that we do for physicians every year. He does the mold part, he does the Lyme part, and I do the mold and the limbic and vagal and mast cell pieces as well. And Rich keeps finding, I know I keep hammering away at him. We've been doing this for years. He keeps finding that he'll call me and go, Neil, I just had this Lyme patient and they're so stuck that I measured their mold and it's off the charts. And I treated the mold and they're so much better. And so even a seasoned, fabulous Lyme physician, I consider Rich to be one of the best. I keep having to browbeat Rich to remember to look for mold. He's there. Not all of the Lyme literate doctors out there have the joy, the pleasure, or the annoyance of me in your head going, did you check for mold? Huh? But I want to do that to all of you who are listening to this. Please, if you have Lyme disease and your treatment is stalled out or not moving or you're not progressing the way you should, please check for mold. It's almost certainly that's what you need to be working on next. So if that's all you learned from me today, we're doing well.
Can I expand on that a tiny bit and say, even if you don't have Lyme or you don't know that you have Lyme, but you have a new strange set of chronic symptoms, migrating, roving, weird symptoms, neurologic things, GI things, skin things, breathing issues, I think we have to just say, like, this is a huge problem for so many people, and long COVID. Just like you're concerned about the Lyme community missing mold, I'm concerned that the long COVID community is missing vector-borne diseases, chronic infections, and toxic mold.
Yeah, it's all part of the same soup. For those who have an illness which has not clearly been diagnosed and you've not had mold and Lyme looked for, it should be top of your list.
Totally agree.
Yeah.
So thank you for your time. This has been fabulous. And I know that our hour is just about up. Where can people find your books? I know that you're not, so you are seeing patients in tandem with other clinicians, right? You're not.
Right.
Okay.
I retired technically 3 years ago, but nobody who knows me thinks I'm ever going to retire. So I do a lot of teaching, writing, and a ton of consulting. My consulting is always with a patient's treating physician and the patient. So it's a Zoom call like what we're doing right now. And with your doctor on board and the patient, we'll go over all of the details of their healthcare, and I'll try to help them put together what they're missing, where to move next, how to approach this step by step. And I do a ton of that. If you go to my website, which is simply neilnathanmd.com, you can reach me if you're interested in consults. The books that I've written that you probably most want to look at if you haven't, number one, my bestseller, Toxic. It covers all of this in a perspective that I don't think very many books do, where it tries to put the bigger picture together for you. And my newer book, the Sensitive Patients Healing Guide, specifically focuses on those who have gotten sensitive to help you figure out what's going on in your body, what's triggering it, and how can we treat it. I'm very gratified that I know those books have helped thousands of people already, and
Yeah.
I hope that more people learn about them so that they can get the benefit.
I highly, highly recommend them both. They were life-changing also for multiple clinicians that I've heard from who've read your books. And in fact, I learned about you many years ago when Toxic first came out from other doctors who read it and sent it to me. So thank you for everything that you're doing for
My
all of
pleasure.
us.
My
So,
pleasure.
so appreciated.
I'm a very weird man. It's not normal in the world that we live in, but I just like helping people.
You're a mensch. That's what they say.
Thank you. I'll take that with honor.
Well, thank you so, so much. Thanks.
Thank you so much for having me.
Thank you for joining us for this episode of Tictective, a program of the Bay Area Lyme Foundation. For more information or to get involved, please visit us at bayarealyme.org.